I'm presenting on behalf of colleagues from London School of Hygiene and Tropical Medicine, Public Health Foundation of India and University of Aberdeen. Particular acknowledgement to James Milner, who was the first author on this study. This study was just recently published in the first issue of the Lancet Planetary Health. And I'd encourage you to look into this journal if any of you are interested in the area of health interactions with agriculture and to environmental natural systems. So a quick look at the food system in India, changing pressures on the food system. So we see a growing population, and of course we also see an urbanizing population in India. We also see changing dietary patterns. So here this is national level data looking at sugar and milk consumption relative to 1970 up to today, up to 2013. And we see sugar has almost trebled in per capita consumption, and milk has more than doubled per capita consumption. And at the same time, we see a changing disease burden. So we see disease burden due to nutritional deficiencies is declining, which is great news. Still a long way to go. We also see a rising incidence of nutrition-related chronic diseases, such as diabetes. And a further bit of context to the food system in India. This map shows the percentage of cropland that's irrigated in India. The red areas there, over 75% of the cropland is irrigated. Irrigation plays an incredibly important role in food production in India. Of course, it allows you to produce more than one crop per season, 2 or 3 crops in some areas. And also it allows you, when you have a dry period, of course, to supplement and prevent the crop suffering from water stress. So you see significant areas of India rely heavily on irrigation, particularly in the northwest of India, which is considered the breadbasket of India, producing a lot of the rice and wheat that's consumed around the country. And then if we look at a very low resolution map, I guess, of where there's water stress occurring in India. So this is where the net extractions of groundwater are exceeding, the red areas are where the net extractions of groundwater are exceeding the replenishment on an annual basis. We see some overlap with the areas that rely heavily on irrigation, and this is to be expected. The water is being drawn out of the ground for irrigation. It also presents us with a potential problem looking into the future. So moving to this study. The first thing that we did was, rather than look at national level dietary data, was to identify some distinctive dietary patterns. And we turned to a large-scale dietary survey run by the Public Health Foundation of India called the Indian Migration Study. I've just labeled 3 of the patterns there, just there's limited space. On the y-axis here is greenhouse gas emissions, so kilograms of CO2 equivalents per capita per day associated with the production of those diets. So what we did is, prior to this study, is we looked at life cycle analysis of agricultural production in India, and we managed to quantify the greenhouse gas emissions associated with the production of different food groups. We matched that to the consumption data. And where you see these box plots, the range on these box plots is due to variation in dietary consumption within those patterns. So we see quite a range, and we see differences between the patterns, and we obviously see differences within the patterns as well. Just to put that into some kind of international context, all of these dietary patterns, the greenhouse gas emissions were lower than what we would see in the UK. That's despite the fact that agricultural production in India on average is lower. The productivity is lower than in the UK. And then if we look at blue water footprints are effectively the amount of irrigation water that's required in the production of diets. So here again we see variation between the dietary patterns and within. But actually we see almost an inversion of what we might call, of the environmental footprints from the greenhouse gas emissions. So here we see that the wheat-based patterns there in green and purple required more irrigation water than the rice-based patterns. And that's predominantly because wheat is grown during the dry season in India and will rely more heavily on irrigation water on average. And the y-axis there ranges from 0 up to 1,800 litres per capita per day. So these are significant. If we multiply it up by the population size of India, we can see a huge use of freshwater resources. And again, to put that into some kind of international context, these are all much greater than we would see in the UK, where agriculture predominantly relies on precipitation. So this optimization study had a couple of key research questions. The main one was, what could we do in terms of changing the dietary patterns to address future freshwater constraints due to population growth up to 2025 and up to 2050? But at the same time, of course, we want to meet nutritional guidelines and also minimize deviation from existing patterns. And that's where we hope we can come up with some changes that are broadly realistic. The method, very briefly, was an optimization model where we set certain constraints. And the outcomes we were interested in were water footprints, so particularly the blue water footprint, the amount of irrigation water required, life years lost due to nutrition-related chronic diseases, and we also looked at what would happen to greenhouse gas emissions. So a quick look at the results. This is what happened to one of the dietary patterns when we ran it through the optimization model. This dietary pattern we labeled wheat, rice, and oils. The current consumption is indicated in the green bars and the optimized consumption in the red bars. I just want to draw attention to a couple of the key food groups that changed. So wheat, we saw the consumption of wheat coming down. And this was because, as I said before, wheat predominantly relies on irrigation water. And we also saw the consumption of dairy coming down in this dietary pattern. On the other hand, we saw most of the fruit and vegetable food groups consumptions increasing. And what happened to nutrition-related chronic diseases? This is just one example, coronary heart disease. We see across the different patterns there, again, the 5 different patterns, we see differences, but overall in this population, we would see a reduction in years of life lost due to coronary heart disease. So here, anything above the dotted line is a positive, is an improvement for health. But it wasn't consistent across the dietary patterns. And this was the same for all the different health outcomes we looked at. Generally, it was a positive story, but it wasn't consistent. And greenhouse gas emissions, this was just a byproduct of the model. We wanted to see what would happen to greenhouse gas emissions. And again, generally a positive story, but quite uneven between the dietary patterns. So quickly, some interpretation of these results. So the first headline finding, I guess, is that with relatively small dietary changes, we could go some way towards mitigating future water scarcity. And this would deliver potential co-benefits for human health when we look at nutrition-related chronic diseases. But one thing we did note is that some of the optimized changes, so some of the changes to the food groups, run counter to the existing trend in consumption. So we saw, for example, that milk consumption has increased rapidly since 1970 up to today, and we expect it to carry on increasing. The outputs of the optimization model suggested that we might have to reduce dairy consumption among some groups. Proactive or reactive, this is just a comment. We didn't assume that the water constraints would force changes on diets, but neither did we assume that the dietary changes were going to be implemented in anticipation of water scarcity. We didn't make either of those assumptions. I think the proactive option is going to be challenging. The reactive option is potentially damaging. So some limitations in future research. So we note that we used across the time periods we looked at, so up to 2030, we used static and highly aggregated water footprint data. And we're working on that at the moment to generate some new spatially informed water footprint estimates across the country, and also to look at key production side changes. So the key factor here really will be irrigation efficiency and yields. As those improve over time, hopefully, we can start to reduce the amount of irrigation water required to support diets. And the other limitation, so as I mentioned, we turned to the Indian migration study for our dietary data. This is not a nationally representative data set. It is a large data set where we thought the food consumption data was reliable, but we will now be turning to household survey data to get a national picture, looking forward. And with that, I'd just like to thank you.